Hello, I'd like to extend a very warm welcome to everybody to this Kidney Care in a Multicultural Scotland webinar with Kidney Care UK and Living Kidney Donation Scotland. Could I have the next slide, please? My name is Jen Lumsden. I'm a lead nurse for Living Donation Scotland, and I'm just going to go over some of the housekeeping before introducing our chair. During our webinar, please feel free to post your questions using the question and answer button on the screen. That's not the chat button, it's the question and answer button. We've had quite a number of questions sent in already, but we're going to try and address as many question and answers as possible. There'll be questions answered from the panel after the presentation, and questions can be upvoted by clicking the thumbs up next to the question if you see it in the question and answer panel. We can't answer personal medical questions, and we advise you to talk to your own kidney team about any personal medical issues, and any technical issues, please post them in the chat box and their team will try and resolve them promptly. In the chat box, we've done this every time. It's really useful if you wouldn't mind just putting in just where you're from so we can get an idea throughout the country where everybody is joining from, and any comments that you have as well. And very importantly, the webinar is being recorded and it will be available with subtitles on YouTube and a summary report on the Kidney Care UK website. I would just like to extend a personal thanks to the team at Kidney Care UK, who as ever have been so helpful to work with to provide this webinar for you, and I am looking forward to hearing the speakers. I'm going to pass over now to our chair, if we can just introduce Dr. Samira Bell. And Dr. Bell was appointed as a consultant nephrologist in Ninewells Hospital at Dundee in 2010, after carrying out both her undergraduate and postgraduate training in Glasgow. She was appointed in 2019 as a senior clinical lecturer in the Division of Population Health and Genomics in the University of Dundee, where her main research interest is renal epidemiology, and she's currently chair of the Scottish Renal Registry. So thank you very much indeed for chairing this webinar. Thank you.
Thank you, Jen. I'm delighted to be chairing this session and like to thank Kidney Care UK for the invitation. So we have a great programme coming up. We've got 3 excellent speakers. So we're going to start off with Deborah Duval, who's going to talk about Kidney Kitchen with post-transplant recipes, multicultural recipes and weight management. And then followed by Bushra Riaz, who's going to talk about perceived barriers in promoting organ donation in a multicultural society. And our final planned speaker is Zubair Ahmed, who is going to talk about increasing transplant opportunities in a multicultural Scotland. Following our 3 speakers, we will move on to a panel discussion where we will answer questions. So we'll keep all questions to the end. We've got a number, as Jen said, a number of questions already lined up, but we'll attempt to answer as many questions in the chat that we can. So I'll start off by introducing Deborah. Deborah Duval is Kidney Care's UK Managing Editor, and she's the lead for the Kidney Kitchen project. She's also a patient with a long history of chronic kidney disease and has had 4 transplants, with a previous simultaneous kidney pancreas transplant and a second kidney and a second pancreas. And so it was her struggle with the restricted diet that inspired her really to start the Kidney Kitchen project. So using professional chefs and renal dietitians, she has formulated over 100 exciting and tasty kidney-friendly recipes, with a number of recipes having culturally diverse influences. So in the back of this success, Kidney Kitchen's first recipe book is about to be launched. So I'll pass you over to Deborah. Thank you. Sorry, Deborah, I think you're on mute.
Yes, I thought you might notice that one. Hello, everybody, and thank you very much for inviting me to speak this evening. I feel very honoured. We're touching base at a really pivotal time in the Kidney Kitchen, and I always start off this chat. Some of you may have listened to a previous talk that I've given, and I always start off these talks in the same way, and that is, Hands up if you're a patient and you've been on a ward and you hear the dietitian come onto the ward. Hands up those of you who have pretended to be asleep. Okay, so that's most of us. And the second question is, who's gained weight over lockdown? So I'm going to ask you to watch a short video. Some of you may have seen this before. This is simply to let you into the kidney kitchen and see how we are doing, what we're doing, the type of chefs we're inviting into the kidney kitchen, and how we're progressing. So I'll meet you in about 2 minutes after you've watched the video, and we'll go through those topics that we just discussed. So I'll see you in a moment. Video, please.
Hello, welcome to the Kidney Kitchen. Today we're going to be making shepherd's pie, passion fruit and raspberry mousse, ginger, coriander, watercress salad with some pan-fried salmon, creme brulee, a Greek lamb with some orzo pasta.
Welcome to Kidney Kitchen. We've been working with Paul Ripley, great chef, been creating some lovely meals that will keep you well, but also you can enjoy alongside your kidney condition. Great piece of salmon, lovely source of protein. Some people may be a bit concerned about the amount of protein. There's guidance in the food facts that go alongside this recipe, and they can look at that.
The toasted sesame seeds.
Toasted sesame seeds are high in potassium and phosphate, you're absolutely right. But we've used 1 tablespoon across 4 people, so.
Minimal. So we get to the day of filming and the camera operator will be here. We have the photographer here. We actually have a kidney patient here as well that gets to try the food as well. And then there's the dietitian that comes on camera with me and talks about what we've just done. Again, gives some alternatives, what we could use and what we can't use.
And it's got a bit more phosphate in it because of the eggs. So we'd say to people, if they're on a phosphate binder, they might want to take it with this.
Well, it's not just me. It goes up the line a long, long way, comes back down again, and then we deliver it in the kitchen itself. So there's a lot that does go into producing just one dish in the kidney kitchen. 20 minutes, gone?
Yes, exactly 20 minutes, and that salmon looks nice, don't you think?
That's really nice.
All ready for now for plating.
Big plate of food. Not too much, you think?
So I suppose when we talk about the meatballs, we've got quite a lot of meatballs on there. So maybe if we're talking about pre-dialysis patients trying to reduce their protein intake, maybe half that amount.
So you've got a nice piece of fish, which you put on there, and then at the bottom there, and you see the lovely red sort of dressing. That's just created from all of the smoked paprika that's sort of all mingled together, and the fennel seeds that are in there as well. So
beautiful,
lovely. There you go.
Rosaline, ladies first.
Thank you very much. I'm looking forward to this. The Kidney Kitchen is full of colourful food. The whole family will enjoy it. If you come back from a dialysis session tired, you know there's going to be food in your freezer you can bang in the microwave, and it's still good, healthy food that you're going to enjoy. So I urge you, as one patient to another, to just take time to look through some of the recipes, read some of the documents that the dietitians have posted. It's all great, fun, interesting stuff. None of it's intimidating, easy to follow, and I really hope you start enjoying food now.
Thank you very much. We've taken up a little bit more time than I thought we would. So I want to talk around 3 essential topics, and that's our first recipe book is about to be launched, and we recognise that not all people enjoy accessing recipes via the web. They like to have a hard copy recipe in front of them. So if you're one of those patients or you're looking after one of those patients, speak to your renal dietitian. We will be sending these out to all renal dietitians free of charge by the end of the month. So some specifics. Some of us have gained a few extra pounds over lockdown, and I'm one of them. So if you go to the Kidney Kitchen and you look on your food facts on each recipe, you will see hints and tips on how you can reduce the fat or calorific content in each of these dishes. Why would you want to lose weight? Some of you might be quite considerably overweight, and you might not be listed for a transplant at your current weight. It is not easy to lose weight when you're on a renal diet, and it is less easy if you have to follow a diet for your diabetes as well. So we've taken that into consideration when we talk to our dietitians and our chefs and our recipe developers, and we've tried to provide you with a lower calorie, lower fat version of every single recipe. Now, some of them already are low fat and low calorie. So I can but urge you to look at the recipes. If you need to lose weight, or indeed if you need to gain weight, we give you hints and tips on how to do that as well. Dialysis can make some of us really emaciated and thin, and so those hints and tips are on the Kidney Kitchen to help you either lose or gain weight, but certainly will help you maintain a healthy weight, and that is really important if you're going to live with kidney disease for a long time. And one of the things I would urge you to do is maintain a healthy weight. It's one of the top priorities that I've of my own priorities for the past 35 years. I absolutely refuse to gain weight, and I absolutely refuse to get to a situation when I'm on dialysis where I'm just too thin to be doing anything. So it is really important, and the Kidney Kitchen will help you do that. The third picture we've got there is world flavors. We've got some amazing guest chefs coming into the kitchen: Caribbean, North African, Asian. We have a wonderful Malaysian dietitian who comes in to the Kidney Kitchen, and we've just appointed a recipe developer, and we are very much concentrating on world flavors. So my ask to you is, if we're not providing the sorts of dishes that you would like to eat, you and your family would like to eat, please get in touch with us at Kidney, or me at Kidney Care UK. We'd love to hear from you. We've had some impossible recipes to get to within the limits of what is healthy for a kidney patient to eat, but all suggestions are welcome, and we will do our very best to process that recipe through the analysis and production team, and quite possibly see your recipe in our Kidney Kitchen. Now, I'm mindful of time, and I'm mindful that we had a little bit of a hiccup there. So I'm going to pass over to the next speaker, and please feel free to ask me any questions at the end of the conference. Thank you.
Thank you, Deborah. That was an excellent run through about Kidney Kitchen. So as Deborah said, we'll take the questions at the end. So I'll move on to our next speaker, who's Bushra Riaz, and she's going to talk about perceived barriers and promoting organ donation in a multicultural society. Bushra Riaz joined Kidney Care Research UK 5 years ago, and she's the Scottish Peer Educator Coordinator for Kidney Research UK's organ donation programme. She's a graduate in management and maths and holds a master's in marketing. And having worked full-time in marketing for several years, after her third child, she initially became a valued volunteer in Glasgow for the charity, and then was recruited as a coordinator of the project in Glasgow and Edinburgh. So I'll pass it on to you, Bushra. Thank you.
Thank you, Samira. Thanks for the introduction, and thank you, Kidney Care, for allowing me to speak today. Thanks. I am, as Samira said, Bushra Riaz. I'm the Scottish Peer Educator Coordinator at Kidney Research UK, and today I'm going to be talking about the perceived barriers to donation in multicultural Scotland. Next slide, please. So, what are the common barriers within the South Asian communities? We see that attitudes and beliefs are one of the biggest barriers that we have to overcome when working with these communities. Attitudes and beliefs are something that's embedded within an individual, and it takes a lot of time and effort to change these attitudes and beliefs, and especially when it comes to donation, because it is such a taboo subject. Through education, this can overcome this barrier. There's also myths and misconceptions, and again, this is one of the common barriers, especially now with the change of law. We see that with social media, it can be a positive step where we can get messages across thousands within an hour, but also misinformation can be spread just as easily. So that is something to overcome within these communities. It's something we have to be quite active with. There's a lot of learned behaviour with elders, which is passed down within generations. As we can see, that donation is a taboo subject. It's not really discussed, and within the South Asian communities, it's the attitude where if it doesn't involve us or it doesn't affect us, then it's not really our issue. So with the elders, we always feel that there's a dominant male figure within families, and sometimes to change their behaviour, it has a knock-on effect within generations. But if they are quite as you would say, quite adamant in their decision making, then this again can have a negative knock-on effect in the family. Like I said, it's a cultural issue. It's a taboo subject. It's not really discussed within the South Asian communities. Due to this, there's a lack of education and awareness on donation. And one of the major barriers that we have found as well, that faith issues for people to understand what is allowed has been one of the main reasons why people donate or they don't donate. For example, within reincarnation within the Sikh and Hindu communities, they think, well, if we decide to donate, to our loved one, will we be reincarnated with organs missing? There's a lot of uncertainties within religion, and also the main question is, what are faith states? Also, there's mistrust within the NHS in terms of deceased donation or even living donation. If, for example, a kidney is removed and it's not viable, what happens to it? The misuse of organs, the quality of care. So again, with education, we see that we can overcome these barriers. Next slide, please. As we see within living and altruistic donation, there are also gender barriers as well. So for example, if a woman decides to donate to a loved one, the questions arise: will she be able to marry? Will she be able to conceive? Is there going to be constant illness? And again, if a man decides to donate, will he be able to get married because he's going to be ill? Will there be constant hospital? Again, will he be able to conceive? And the impact on the family as a whole. So I feel these are some of the most common barriers within the South Asian communities where people decide not to donate. Next slide, please. So the Scottish Peer Educator project, which we have been running very successfully with Kidney Research UK, in 2013, the Scottish Government approached the charity, and initially it was a 2-year funded project with the peer educator approach, and we're now successfully into our 8th year. The peer educators are volunteers who are community members that work with community members, and our project focuses on raising awareness within the South Asian communities, the Hindu, Sikh and Muslim communities about organ donation, kidney disease, and quite recently within the opt-out change of law in March 2021. Next slide, please. So the impact we've had within the project is we've engaged with over 7,000 people. We've had over 1,100 people sign up, and I think that is ongoing as we speak. And I mean, we all know one donor can save up to 9 lives. There's a lot more awareness and discussion taking place due to the project. There's a lot of inquiries, and this project has been one of the most successful ones within Scotland, and we have won many awards due to our success. Next slide, please. We held one of our first Scottish Muslim Imams events in July 2019. I think this is one of the major events we had pre-COVID, where we had 40 plus Imams of Scotland of the Muslim faith, and they all came, and the fatwa that was published by Mufti Zubair Butt about organ donation. So with them coming and attending, it then meant that they can then go on and speak to their community members and have religious talks about the importance about organ donation. Next slide, please. So we do see that education is the most powerful weapon which can be used to change the world. And this is what we feel is the peer educators can do within the communities. Next slide, please. So I'm just going to run through just 2 case studies from Glasgow that we've come across in our work. Ifrah on the left of the picture, sorry, the right of the picture. She's 30, and within her 30s, she wouldn't give me her exact age, but she said, I'm in my 30s. A Scottish Pakistani Muslim. She is qualified optometrist and runs her own successful food dessert business. Ifrah had kidney failure at a young age, her first transplant at 13 years, having dialysis 3 times a week. Then having the discussion with her family, her maternal uncle decided to donate his kidney to Ifrah at 17 years ago. After 17 years, sadly, her kidney failed again, and she was getting ready to go back onto dialysis, and her younger brother decided to step forward, having seen what her uncle had achieved after his kidney transplant, went on to get married, have children, and there were no issues. He decided to step forward. So they had their, so she had a transplant last year in COVID. I have a short video, which Ifrah had made, just there's no sound to it, so I'm just going to speak over it. If you could just play the video, please, which kind of just shows, which I'm sure many of you do know, the regime of the dialysis and what happened. So 2 years of dialysis. Her uncle donated his kidney in 2013. She graduated while from university as an optometrist, travelled. Kidney started to fail again 2019, went back on dialysis. Just the stress of it all, I think she was just, it was overwhelming. And then her brother decided to step forward and become a living donor to Ifrah. Just some of the pictures. So that was her uncle and her. That's her brother, their younger brother, just after the operation that they had last year. And like day 3 of them. And just, I mean, I've spoken to Ifrah and her brother, and they're doing remarkably well. And it just shows you her pictures, dialysis and her post-transplant and 1 month post-op. So the second case study is with Amna and her brother Farooq. That picture shows Amna and her husband and her young son. Amna was diagnosed with primary hyperoxaluria, which basically means that the oxalate levels in her body wasn't filtering out, which meant that she had liver and kidney failure. She had no symptoms until she realised that she had kidney failure, and that was diagnosed when she fell pregnant, and they realised that her kidneys were full of stones. She gave birth to her son, and for the first 5 years, she spent her time in hospital. Many months go by through illness. Then, having obviously going through kidney failure, dialysis 3 times a week to clear the oxalate to safe levels for transplant. After 5 years, she had a liver transplant from a deceased donor in January 2017. Having seen what she'd gone through, obviously her family were all tested and wanted to come forward to become living donor, to donate their kidney to her, and her brother was a match, and he donated in December 2018. And Amna now lives a very healthy and normal life and enjoying being a mother to her beautiful son. Next slide, please. So why approach your family to become a living donor? We all know for a successful transplant, blood and tissue types need to be a match. So they're most likely to happen when the donor and the recipient are from the same ethnic background. For living donation, there are no religious barriers to become a donor. And all religions say it's a form of charity, and what better way to give to your loved one and to improve and help them. Obviously, education is the key. It overcomes the fear with knowledge. And obviously, for your loved one, what better way to help? So next slide, please. So we'd just like to say thank you to the Scottish Peer Educators. Without them, the success of the project. Nirja Jain, who's the Health Equalities Programme Manager, the staff and management at Kidney Research UK, Scottish Government and NHSBT, and Kidney Care, thank you very much for allowing me to talk today. Thanks.
Thank you, Bushra, for an excellent talk and for sharing your important work. I think the case studies were particularly inspirational to see how living donation can change the lives of these patients. So we'll move on to our final speaker, and this is Zubair Ahmed, who's a consultant general in vascular and transplant surgeon for Greater Glasgow and Clyde. He trained in Glasgow, London and Calgary in Canada, and his research interests include living donation, living donor nephrectomy and health management. So I'll pass you on to Zubair. Thank you.
Hi, good evening, everyone. Thank you, Samira. Pleasure to be here. Pleasure to follow on from our 2 speakers, particularly Bushra, who I've got to know well over the last year or so. The topic is expanding opportunities in multicultural Scotland, and I suppose I have a vested interest since I'm a product of that multiculturalism, and as are my children. I suppose traditionally the predominant culture apart from Scottish culture that's kind of come to these shores in most recent times has been from the Indian subcontinent. But of course, we're ever expanding what we're becoming exposed to as a country and what we're kind of intertwining with. And a lot of what Bushra has touched upon, I'm very optimistic about, certainly in the last 5 years. I've seen the whole journey that many people have taken, that from many these communities that Bushra spoke about, from where there was complete, denial about A, the problem, and B, engaging with any of the solutions, and including transplantation, to tacit acceptance. And now really, certainly in the Muslim community, the Pakistani community, and the Indian community, I feel like I feel able to comment upon, to active promotion and engagement. And it's been really refreshing to see that. So I think we have to be a little bit careful sometimes that we don't pigeonhole people too much, to say that if someone is from those backgrounds, that we automatically assume there might be a greater degree of reticence to engage in transplantation, or a discussion about transplantation, or a discussion about donation, because I think that simply isn't true. That is not the stereotype that really exists, or in my kind of experience, prevails anymore. There's much more of a heterogeneity about people's attitudes, beliefs, even in the communities that we're talking about, and it really is changing, at a rapid pace, and that's in no small part thanks to people like yourselves here and Bushra, and for all the hours of hard graft they've put in to engage in discussions and bring people, together literally across the table that would never have sat across the table. I mean, I've sat across the table from Imams to different faith representatives, and some people who are very ably qualified both in medicine and in theology, and really have, generated almost a new kind of, I would say, social science in some of the research that they've done. So I'm very optimistic about the future. So as far as living donation goes, I think that is really probably the predominant modality at the moment, especially in some of the ethnic minorities, in terms of how they receive a kidney. And Bushra's totally right. There's a lot of fear about what that has in terms of long-term impact. But that's when the data comes in to really inform us about what happens 5, 10, 15, 20 years after you donate a kidney. And the answers are, I think, relatively reassuring, in the sense that most folks that donate a kidney go on to have a perfectly healthy, normal life. There's even been data now looking at pregnancy and outcomes. And generally speaking, just because you've donated a kidney would not impact upon you being able to conceive a child and deliver a child. And similarly with men, it wouldn't impact upon your reproductive health in any way in the long term. So as many more donors come forward, we're accumulating many more years of evidence to kind of prove the safety of these procedures, and really, promote them as a really viable modality in our fight against kidney disease, and enabling transplantation to happen. And within that, the living donation aspect particularly allows us to transcend barriers of transplantation that previously existed. So, traditionally, we wouldn't have necessarily been keen to transplant folks with different blood groups. But now, with living donation in particular, that becomes a possibility with new drugs that are coming online and have been used for many years. And similarly, then touching upon deceased donation, I think this is an issue across all communities in Scotland. People ask themselves, well, do I really have to donate? Would it really help anyone? I'm not the fittest chap or lady in the world. I've got high blood pressure. I've perhaps even got diabetes, or I'm just simply too old. And the answer is, we are more and more, using kidneys that 10, 15 years ago we weren't using. And we've again shown that we're using them with a relatively high degree of success. So you simply isn't anyone, I think, out there that, should think of themselves as being unable to donate because of some self kind of imposed restriction on their health status or on their age. And that's particularly, I think, important and pertinent at the moment when we've got new technologies coming online that can help some of those organs from deceased donors to be utilised. So we've got now equipment, essentially, that once that kidney comes out of the body, we can almost sort of do a trial test on a machine where we can inject it with warm blood and see how it functions. And some of that technology is, you know, in its infancy, but it's coming along and it's helping us make decisions about using kidneys in people we previously would not have used. Now, of course, we can't really touch upon donation without touching upon, I suppose, the law change that has taken place recently. And again, I think that's been a very positive thing. Not in the sense of the law changing itself, because I think it's important to remember for folks that are worried about that the law change does not in any way, even now, stop your next of kin from, you know, representing you after death and putting a brake on donation. It's what's called a soft opt-out. All it allows us to do is assume someone is donating until the point someone tells us that they're not donating. And therefore, I think the most kind of valuable component, I think, of that whole process has actually been some of the discussions that is allowed to happen within families, between loved ones, between clinicians and families, and between clinicians and individuals, and indeed within ethnic minority faith groups and cultural groups. And I had a very good experience with Bushra and colleagues and friends across the United Kingdom when it came to writing a leaflet, an information leaflet for the Muslim community, following this law change. One, to reassure them that this wasn't anything untoward, and B, to use it as a portal for discussion about having these conversations with one another about whether you feel it's something that's appropriate for you and your beliefs, and if it is, how best to share that with your loved ones. And I think that was so valuable. And I think, you know, if and when the rates of donation increase because of the law change, it'll be because of, as a surrogate of the fact that people are having those discussions and are just becoming more comfortable with the idea, because it really has put organ donation after death on front of center, you know, in many communities' minds. And I think that can only be a good thing. And like I say, I remember a time where there were people in my own community that would have not even countenanced a discussion about that, you know, never mind engaging in it and carrying a donor card and finding themselves at mosques promoting it. And in many ways, that journey has followed the same journey that blood transfusion was following 20, 30 years ago. And again, I think my take-home message really is, for those that are, how can I say it, part of mainstream Scottish society, don't assume that because someone is from a minority ethnic background that they will have necessarily a conflicted or a hostile view towards transplantation or towards donation, because I don't think that simply is the case anymore. And to those from minority ethnic communities, particularly the one I belong to, I would say there is a heterogeneity of opinion, and no one is going to make you do anything that you're uncomfortable with, either in life or in death. And there is certainly a lot of scholarly opinion now out there that not only would say that organ donation is, you know, not bad, but in fact would actively say this, it is good, you know, and it is part of the religion. Certainly in Islam, there's a lot of stuff being done at the moment around that aspect of theology and donation. So thank you again for inviting me. It's been wonderful again to engage with the wider kidney care community. Hopefully again do this sometime soon.
Thank you, Zabir, for an excellent run through, and it's really interesting to see your perspectives from a transplant surgeon point of view. So I think what we'll do is now we'll all come together for a panel discussion and we'll answer the questions. So I'll also bring in Jen Lumsden from Living Donation Scotland for her insights, and also Samaya Masood, who is the Deputy Editor for the Kidney Care magazine, but also a patient with a huge wealth of experience as well. So we'll kick off with the questions. So I've got a few questions here that were submitted before. So I think I've got one here for Zubir, and it's also the same one that's come up in the chat as well. We're interested to know what your views are on the outcomes for living donors who donate later in life.
Yeah, so yeah, thanks for that. So I have my PhD was in Guy's Hospital in London, King's College, was essentially around outcomes in various subsections of people that donate a kidney over a longer period. So I feel I can speak from some background of knowledge about the subject. Older donors do very well following donation in the immediate post-operative period, in the kind of midterm, as I would call it, which is the first year, and the longer term. They're certainly no worse off than their younger counterparts in any of those three timelines. And in fact, I certainly found evidence when I analysed the registries that actually in some domains they were doing better. And so that there is absolutely no issue with older folks donating. And actually, as a surgeon, and probably, correct me if I'm wrong, as a nephrologist, you sometimes, traditionally have worried about younger people donating, because obviously they have to hopefully live in terms of a actuarial life, a longer life with only one kidney. And so we actually worry less about older donors, because I think if you've got to your 50s, 60s, 70s, and in fact, the oldest person I personally looked after that donated a kidney was 83. And we tend to worry less about them, and as the data turns out, we're justifiably, we can justifiably less worried about folks who are older. If you've got to that age and you're fit enough to donate, because at the end of the day, you've got to be pretty fit to pass all the kind of checks to get to the point of donating your kidney. You've proven yourself as someone who's pretty fit, and you tend to do pretty well.
Yeah, I would agree with you there. That's a good summary of that. So another question here, maybe for Jen and Zubir, what are the main barriers to assessing overseas donors?
Yeah, so in my limited experience of assessing overseas donors, and this is primarily from my experience in London, where obviously things were a lot more multicultural than even they are in Scotland. And this is experience now is perhaps historical, because that was 5 years ago. They're usually, to be honest, do with things like border force and the Home Office. From a clinician's perspective, I'm more than happy to facilitate donation, whether it's from down the road, down the country, or anywhere else in the world, and we try and support that as best as we can, whether it's writing letters or whatever needs to happen. Of course, they have to go through the same assessment process, both physical and psychological, as any other donor would. But I must say, in the vast majority of cases, we've not found too many impediments to someone donating from abroad if they fulfilled the clinical criteria. We've managed to get them through. I don't know what the experiences have been in other places.
Yeah, I mean, I would agree with that. We do everything, and we've got many years of experience now of working with countries throughout the world. We try as much as possible to establish at least baseline tests for the person who's going to be coming across, and if possible, further renal function and renal anatomy, because we don't want obviously to bring people across here if they're not going to be suitable. So we're very used to communicating with clinicians around the world for this. The Scottish Government issued guidelines about 5 years ago. We will support travel arrangements and to bring somebody here to donate. But as Zubir said, the person who's coming will have to fulfill the Human Tissue Authority requirements of evidence of relationship, whether they're genetically related or otherwise. So, just like anybody who's donating a kidney from within a family or a friend. So yeah, there are barriers, but we're very well used to overcoming them when possible.
Thank you. That brings us on to another question that's saying, will the NHS support UK residents and PSOP assessment tests to become a kidney donor for a relative in another country?
Do
I don't know about the specific package of support, and I've not been. I don't think I've been involved personally in a case where, yeah, I have had to submit anything to donate in another country, but I can't imagine, you know, we wouldn't, you know, intuitively would not have any problems at a personal level or my team supporting that. I'm not aware of the funding arrangements for that. I'm sorry.
We're very used to, you know, first of all, very, very often within the UK, if somebody has a sibling or a friend in another city, then there's a very much reciprocal working with other units around the country, and that extends to overseas country. Obviously, the country the recipient is in would have to pay the travel expenses for the person to go there, but we would do the test and send the results across as we, you know, people will do for us. So it's a reciprocal agreement.
Great, thank you. I've got a question for Sumaya and maybe Bushra. So how to raise the question of living donation? How do you find that, and how does it feel to have family and friends donate?
How to raise the question? Obviously, it's quite difficult within families. I think, obviously, when they see that their loved one is, you know, unwell, they can see them having to endure dialysis 3 times a week. It's something then that, you know, I think it's like I said, you know, within my talk, it's the fear factor of being rejected, of, you know, family members saying, no, I don't want to. I think that's obviously something that they themselves are scared of. And B, it's, you know, the heartache as well, that they see someone else going through an operation. Like no person wants to go through an operation unnecessarily, shall we say, but for the long-term benefit, they can see that it's a benefit to that person that's unwell. And again, I think also having the peer, you know, within the community for members that have had, you know, family members donate, I think that process is really important. So I think bringing up the conversation, and you always do it, we always do it, like so-and-so has done this, so I think we could do this as well. So I think communication and raising awareness about living donation within the communities and having case studies like this is really important. And I think that will overcome a lot of the barriers.
Yeah, I completely agree. And Sumaya, do you want to speak from your own experiences?
Yeah, so my brother actually offered to donate his kidney to me the day I was diagnosed with chronic kidney disease. So I actually was quite lucky in that I didn't have to have that conversation with my family. And it wasn't just my brother, it was my sisters and my mum and dad as well. But in the end, it was my brother who eventually donated his kidney to me. And I think in my family, it wasn't so much they weren't against him donating. I think it was just not knowing what the process was and not knowing what it would be like after a transplant. Would he be well or not? And these were all the questions that we raised with our doctors and the surgeons. And I think that in a way, like Bushra, you said earlier, in a way, education is empowerment. And I think that helped us make that decision a lot easier, that made that decision a lot easier. How it feels for me now, I mean, unfortunately, my brother's kidney that he donated to me, it only lasted 6 years. But for me, those 6 years, I feel as if I owe those 6 years to him. Everything I was able to do in those 6 years is down to him. You know, I got married, I've been able to travel far and wide, I've developed my career. So I think all benefit goes to him, and I do feel like he saved my life. So, you know, we have spoke to other people in a similar situation to ours, from a similar background to us, who are waiting for a transplant. And I think just showing that you've done that, and as Bushra said, is educating people that you've been through it and you're fine. And he's married now, he's got a healthy child. And I think that that's very, very powerful to share your experiences. So, yeah.
Thank you. That's really interesting insights to hear. So I've got a question for Deborah, and this one's in the chat. So it's saying, I'm male, I don't follow recipes too well unless it's a video actually showing you all the ingredients being used. Is there any plans for that?
That's what the Kidney Kitchen is all about. So it's about a 1/3, 2/3 split on videos. So we video every single aspect of the preparation of every single, so we video every aspect of the preparation of a recipe. About 30% of our recipes are videoed from start to finish. So even somebody who doesn't know how to chop a carrot will see how that is done. The other 70% are photographs only, but we have very clear photographs. So 6 very clear photographs will visually show you how you should be preparing this dish. And we get the most amazing emails in from patients who have followed the videos. And whilst their dish doesn't look quite like chef's, it's as near as damn it. So what it shows is that the videos are actually helping people engage. And the fact that you prefer to watch a video is music to my ears, because what I don't ever want to lose is the awareness that I have that kidney disease is a very isolating experience for a lot of people. So marriages fail, men find themselves without someone to cook for them. And if you're a woman and you've had a man in your life and they cook for you, sometimes kidney failure can determine an end to that relationship, and you find yourself in the kitchen having to learn to cook. So to that end, what we've also done, and they're not on the website yet, but they will be over the next couple of months, are a series of kitchen skills. So if you don't know how to boil a potato, if you don't know how to chop an onion, if you don't know how to chop a carrot, we will teach you in the Kidney Kitchen. So we've got simple 30-second videos to show you every aspect of how to cook this food. And that set of kitchen skills will expand as we incorporate more by world flavors. And I'm learning so much, well, from Samaya, who will be cooking in the Kidney Kitchen towards the end of this year, some wonderful recipes for Eid and Ramadan. So I'm learning as we go along. So these kitchen skills, we'll develop them in the kitchen. But yes, thank you for the question. Yes, you've endorsed the use of our videos. Thank you very much. We will continue to do these videos.
Thank you. Great. I've got another couple for you, Deborah. So there's one: potatoes have too much potassium, even if pre-boiled. Other than white turnip, what else can make fake chips?
So I'm not a dietitian, but I will say, you're speaking to me, I'm in Cornwall, okay? So what you're asking me, I love clotted cream. We have clotted cream quite a lot down here, in fact, way too much. It's like you're asking me to say, is there a version of clotted cream that doesn't have fat and doesn't have any dairy products in? So a chip is a chip is a chip. But what I will say is, if you go to the Kidney Kitchen and you perhaps look at the fish and chips, kidney-friendly fish and chips, you'll see how we've made chips that are absolutely delicious. I can vouch for that because I've tasted them. Using a method where we have minimized the amount of potassium in them, but we've increased the flavor by adding some spices. So perhaps I'd say don't eat as many, but certainly go and look at the chips that we've got in the Kidney Kitchen. Personally, I wouldn't be looking for other vegetables because you're always going to compare it with a chip. Just treat yourself to kidney-friendly chips now and again. So nothing is out of bounds in the Kidney Kitchen. You will find recipes with tinned tomatoes. You will find spinach and, asparagus in some recipes. But what we've done with the dietitians is we've made sure that we've kept them to within certain parameters so that we can still call that dish a low potassium dish. So actually we're opening up the whole world to you. Obviously, don't go stuffing yourself with bananas, but some of our recipes have got bananas in them. So follow the recipe as it dictates on the Kidney Kitchen, and you will still find, in most cases, you're eating a very low potassium dish. So go and eat your chips. Just make sure they're as kidney friendly as possible. Don't have them too often and don't have too many.
And there's a question here saying, my little boy is 3. Do you have any child-friendly recipes available?
Okay, so yes, and this is somewhere we want to go with the Kidney Kitchen, because obviously pediatric patients, I was diagnosed with diabetes when I was a child, and my parents became obsessed with weighing all my food and not allowing me to eat certain things. And we don't want that for children these days. We want the diet to be as fun, as friendly, and as accessible as possible. So things like, we've got our lemonade scones. It has 3 ingredients. Like, children will love to make those. They are made within half an hour and you'll have a batch of scones. Low potassium, made with lemonade. They're great fun to make. So whilst I would suggest to you speak to your dietitian, because obviously the kidney kitchen recipes are geared for adult kidney patients. They may suggest modifications that you can make to those recipes to make the portion smaller so that it fits within a pediatric dietary requirements. I'm not qualified to point to any particular recipe, but I would certainly go to the lemonade scones and have a bit of fun in the kitchen cooking some lemonade scones. But speak to your pediatric dietitian, and they will receive a kidney kitchen recipe book soon. So go through that recipe book. The lemonade scones are in that recipe book, and they may help you select a few recipes that you can make with your children. But longer term, certainly on the agenda, we will be looking at pediatric dietetic needs in the kidney kitchen. And good luck, and always just ask. We can always find a dietitian somewhere to find the advice that you're after.
Can I just ask as well, another question is, do you need to get the kidney kitchen book through a dietitian, or will it be available on Amazon?
I wish. No, what we've done is a run of the recipe books, 12,000 run, and it has been printed. These will be going out to all RNG affiliated dietitians. We'll be sending one out the week after next, with the option that they can order in batches of 30, 50 or 100. When that 12,000 is gone, we will do a reprint. We have to assess whether we can just keep printing them and sending them out free of charge, because the first 12,000 go out free of charge. But it has always been very dear to my heart that access to this book should not be based on whether or not you can afford it. So many patients don't have any money and they've lost their job. And so we can't say, you know, well, you patient, because you can afford to pay £12, but you can have this, but you patient who have only got £1 in your purse, you can't have it because you can't afford it. I couldn't possibly live with that. So we have to find a way. We've got some friendly pharmaceutical industry partners. We will find a way of getting as many of these to patients as we possibly can. The first run will go to dietitians, the second to patients, and we hope just for the cost of the post and packaging. So if anybody's struggling, they just need to let us know, because we would never countenance that. So access, you will have access. I hope before Christmas, but certainly after Christmas is the answer to that question.
Thank you. So I think we've got a couple of vaccine questions. So is there any development for a better vaccine for people who've had a kidney transplant? So I think I can try and answer that. I'm not aware of a better vaccine, but there's certainly evidence to suggest a third dose is beneficial in the immunosuppressed and the dialysis population. And I think this goes in the back of JCVI's statement yesterday to recommend that patients who have been immunosuppressed will be offered a third vaccine dose. Not had any information on the logistics of how that's going to be carried out, but I think the website, Kidney Care UK website, will be updated as soon as there's any information, so keep your eyes out for that. And there's another question here for maybe Zubir and maybe Bushra could answer. It's quite vague, broad question. Why is it hard for Asians to get a transplant? Do you want to start, Bushra?
Yeah, sorry, I was on mute there. Well, obviously we've got, if we're talking about deceased donation, because as we know within the stats, we are a very small minority within the UK, but we have a very high percentage of people waiting for a transplant. The reason being is people do not sign up to become an organ donor as a deceased organ donor. That's why it's difficult to get a transplant, because as I said within the talk, your tissue type, blood type needs to be a match. And within the ethnic minorities, because there's not enough people donating, then those that are waiting on the waiting list have to wait longer. And I think the last stats pre-COVID were at least a year longer than those from the white Scottish community. The reason why people don't donate, again, lack of knowledge, lack of awareness, and it's again taboo subject. Don't want to discuss it. We don't want to know, and it doesn't concern us, so we don't want to sign up. Now, with the change of law, and like Dr. Zubair had mentioned, a lot of work has been going on behind the scenes within the ethnic minority communities. We've been working with faith leaders, Imams, faith leaders within the Sikh, Hindu, Muslim, Jewish, Christian communities, and the NHSBT leaflets, Our Faith Matters, and what does our faith state? For each individual faith, we have a leaflet which is available online on the Scottish Government website on organ donation, which basically tells you what each faith states about organ donation. And no faith at all states that you cannot donate that you cannot donate and that you can become an organ donor. Yeah, Dr. Zubair.
Yeah, thanks, Bushra. Yeah, I mean, yeah, why is it hard? It's harder, yeah, for sure, for many of the reasons that Bushra has mentioned, going into about the immunology and the matching. But I'll tell you something, before I kind of talk about why it might be harder, I just want to say that sometimes we don't, it's a British and Scottish thing, isn't it? You don't kind of, you know, feather your own cap, but I genuinely think we have one of the, if not the best transplant program in the world in terms of access to transplant, you know, equity of access and all those components, you know, and yeah, it's harder, but it's still much easier than in many places in the world, including perhaps in the kind of countries that we kind of indigenously belong to, where there are no deceased donor programs, you know, at all. And I know that because I get multiple phone calls and emails from people I know from these countries on a weekly basis. Yeah, it's harder, but I think it's getting easier as well, you know, from what I'm seeing. And of course, deceased donation is one component. We need to work on that, like Bushra says, make sure people from our communities are not reticent about putting themselves forward on the donor register and all of that. But also, you know, across the board, half of kidney transplants now in the UK come from living donors. And therefore, there is an element of control there in terms of if family members do wish to come forward. And even if they're not a direct match to you, this is something I should have probably mentioned earlier, that doesn't stop you from facilitating a donation. Because again, this comes back to some of the kind of vast organizational apparatus that works in the background in the United Kingdom of organ sharing. You know, it's amazing. We can do what's called the kidney sharing scheme, where if you're not a direct match to your loved one, 4 times a year, you can enter a scheme where for a computer algorithm, someone else might be somewhere else in the country, so the kidney literally can, you know, swap over, whether that's a direct 2-way swap or a 3-way swap or something more complex. So we participate in that. We make that happen all the time. So yeah, so don't become despondent, you know, if you think your loved one's not a match. There are ways around it, and things are for sure every day getting easier. Yeah, I would have a very optimistic kind of message about that.
Okay, thank you. So unfortunately, it looks like we're running over time, but that's been a great discussion. I'd like to thank the panelists for their brilliant insights and answers to the questions. I'd also like to thank Lynn Cunningham, who's been working really hard behind the scenes, and unfortunately the IT person pulled out the last minute, so Lynn's been doing everything, but she's done a fabulous job, and also for pulling this together and coordinating everything. You'll be sent out a Survey Monkey in a link, so please can you ensure you fill this in so that we can take the feedback on board and try and improve things for future webinars. So I'd like to thank you all for listening, and thanks. Bye-bye.